Welcome to Ask the Experts. I'm Claudia Otero. Today we are focusing on obstetric care provided by our family medicine and obstetrics physicians at SVHC PrimeCare in Salinas. Our experts today are Dr. Kelsey Capron and Dr. Maija Swanson. Thank you both for being here today. We really appreciate it. Well, Dr. Kelsey Capron and Dr. Maija Swanson are both family medicine physicians who specialize in obstetrics. They recently joined our healthcare system and are accepting new patients at PrimeCare in Salinas. I would like to add that they also speak Spanish, which is great for our Spanish-speaking community. Today, we're going to focus on the importance of family medicine and obstetric care, and we are going to talk about the services our physicians provide before, during, and after pregnancy. Dr. Capron, let's begin with you. What does a family medicine obstetrician do?
Yeah, so a family medicine doctor in general is doing primary care, so outpatient in the clinic, seeing all ages and all genders, preventative care, chronic conditions. And the obstetric aspect refers to taking care of pregnancy. Many family medicine providers also are doing prenatal care, and in addition, some may do deliveries and postpartum care. So an obstetrician refers to that pregnancy care and deliveries. Now, an OB-GYN is a different specialist, different from family medicine, who also takes care of pregnancies as well as the rest of the female reproductive tract outside of pregnancy. They might take care of the most high-risk conditions, more complicated issues, or more uncommon issues in that realm, and we'll refer to them for those sorts of issues. But we both take care of obstetric type issues. So family medicine with obstetrics, we're doing the prenatal care, delivery, some of us do C-sections, the postpartum care, as well as seeing your baby, see you in the hospital, see you in the clinic, and hopefully see the rest of your family and take care of you long term.
Okay, as a follow-up, Dr. Swanson, when does a woman or a person need to start seeing an obstetrician?
Yeah, that's a great question. So first off, I just want to comment on the fact that we recognize that some patients who have a uterus and are capable of becoming pregnant may not identify as female. So we do provide care as well for patients who identify as transgender or non-binary. And so in this production, when we're saying woman or female, we are solely referring to the organs that were present at birth and the sex assigned at birth. But I just want to make sure people know that we do provide care for people regardless of their gender identity. So that being said, patients should start seeing an obstetrician as soon as they know that they're pregnant. The reason being that we want to make sure that if there are any chronic medical problems that a person has, that we are addressing those early on and ensuring that they are adequately cared for and controlled to provide the best pregnancy outcomes. In addition, there's a lot of testing that we recommend early on in pregnancy. So as soon as you know you're pregnant, give us a call. We also do provide what we call preconception counseling. So if you are thinking about becoming pregnant, planning on it, or are having trouble becoming pregnant, we can also provide counseling and whatever care you might need there.
Okay, that's good to know. That's great information. Thank you for that. What is the difference between an obstetrician and a gynecologist?
Yeah, so an obstetrician, like I said earlier, is really around all of pregnancy care, whether prenatal care, deliveries, postpartum. The gynecologist aspect is more just the female reproductive tract outside of that period of pregnancy. So that might be dealing with ovarian cysts, pap smears, birth control and family planning, uterine cancer, for example, lots of different things. And most family medicine doctors will take care of the lower risk, more common conditions in the world of gynecology, just like we do with obstetrics. But again, we will refer to our wonderful OBGYN colleagues when necessary.
How is an obstetrician different from a midwife?
Yeah, so the main difference between an obstetrician and a midwife lies in the training that's received and also the degree of comfort in caring for pregnant patients who also might have other medical problems that either started before pregnancy or arose during the pregnancy. So doctors who perform or who provide obstetric care typically go to 4 years of medical school and then complete a residency and sometimes even a fellowship. And so we have a lot of comfort in caring for patients with other medical problems. Midwives typically receive training in caring for normal, healthy pregnancies. And so if you are interested in working with a midwife for your prenatal care, definitely talk with them or talk with your primary care doctor about whether that might be a good choice for you.
And everyone's different, right? So everybody wants a different
Exactly.
way of care. Okay. What is the best age to have a baby? Is there a magic number? And what about older women? When is it not safe to do so?
So there really is no perfect age. There's no real answer to this question other than it's individual. Everybody's going to be different. You know, there's so many different factors that play into whether or not it's the right time to get pregnant and have a child. Finances, whether your family or partner's supportive of that decision at that time, whether you have those supports in your life, where you are in your schooling process or in your career, your own health conditions, like Dr. Swanson mentioned, like whether your health is kind of optimized for a pregnancy to be as healthy as possible. So many different things play into it. So it really is good to discuss with your family, your partner, and your doctor, and you can decide kind of as a team what makes the most sense for you in planning your family. In terms of your question about age 35 or 40 or higher, you know, this is when it can become harder to become pregnant, and it's not like something happens overnight, but it's a gradual process over time. It can get a little bit harder bit by bit for some people to become pregnant. And also there is a gradually increasing risk of having a potentially higher risk pregnancy. Now, that doesn't mean that's going to be true for everyone, and regardless, we are here to help you through that process. We're very comfortable managing pregnancies in that age range, and it's becoming more and more common this day and age to have older pregnant moms, and that's totally normal and okay. So bottom line is just talk to your doctor before you decide it's time to get pregnant, and we can work with you on kind of planning that and making sure you're going to be as healthy as possible before you embark on that path.
Now, do you assist with infertility?
Yeah, so we are able to at least start an infertility workup in our clinic through performing a variety of blood tests, sometimes even an ultrasound, to try and determine what the exact problem is if someone is having a hard time getting pregnant. Sometimes patients decide to seek other ways of becoming pregnant, such as IVF, in which case we would send a patient to a specialist for the actual counseling and procedure on that. But we would be able to provide the prenatal care for the rest of the pregnancy and also do the delivery and postpartum care as well. So it's and usually ends up being something that's kind of a collaboration between us and some of the other more specialized doctors who are part of obstetric care.
What conditions does an obstetrician treat?
So really any condition relating to pregnancy or even chronic health conditions that you already have before pregnancy that may be impacting that pregnancy. So if you have diabetes, high blood pressure, thyroid issues, any manner of things going into that pregnancy, we as an obstetrician will be helping you manage that condition throughout the pregnancy and talking about whether or not it's going to affect the pregnancy and how we can, keep you and baby as healthy as possible. And then during a pregnancy, things can arise. Other blood pressure issues, including pre-eclampsia or gestational diabetes, for example, and we will be managing those with you as well. And then, of course, there are plenty of low-risk pregnancies out there that don't have any special conditions, and happy to take care of those too.
I think you just answered my following question, which was what are the most common types of pregnancy issues? And you mentioned gestational diabetes and pre-eclampsia. Is there anything else that would be in that category as a most common type of issue?
Yeah, I think those are two of the most common things that come up for our patients. Some of the other ones would include preterm labor and the need for a C-section for a variety of reasons during labor. But like Dr. Capron mentioned, there are a lot of other things that can come up during pregnancy. So we are there for whatever you might need.
Okay. What is labor, and speaking of labor, what is labor induction?
So labor induction is the process where we help your body along into labor in order to have your baby. And there's lots of reasons that we want to do an induction of labor for some patients. And really the bottom line is if the risk of remaining pregnant, the risk to either you or baby or both, if the risk is greater when you remain pregnant than it is to have the baby at that time, at that gestational age, then that's when we'd recommend that time to induce labor. We also can do elective inductions if you decide I am just so done being pregnant after 39 weeks. That is also totally reasonable. You can talk to your doctor about that. The process of an induction, you're going to be in the hospital a little bit longer than you would if it was natural labor that comes spontaneously, because we are going to be helping start the process that normally would be going on kind of slow in the background while you go about your day at home if it were to be spontaneous. So it can be a little bit frustrating for some folks. So I always encourage people to come prepared with snacks and things to do, your most comfortable bathrobe or favorite pillow. It's for you and your partner to kind of be ready to hang out as we start that process. You know, it's very normal if it takes 2 or 3 days, maybe even a little bit longer. And those first day or two, you might not feel like anything's changing, but just got to have a lot of patience. That's the most important thing to bring to a labor induction.
So thank you for explaining what that process is like, and especially the part about how you just don't know how long you're going to be in the hospital for. So coming prepared is really important. Do obstetricians perform surgeries, and what type of surgeries?
So the most common surgery that an obstetrician performs is the C-section. So, you know, there are a variety of reasons that might need to take place, whether it's because the baby is breech or there are problems arising during labor that require us to do a C-section. There are also other surgeries and procedures that we do for extra bleeding after a delivery, whether that's a C-section or a vaginal delivery, and also if the placenta is not separating all the way from the uterus, there are procedures we do there. We also can do what we call a tubal ligation, which I think people know more commonly as having your tubes tied. That's a possible procedure that can be done immediately following delivery as well. Since we're family medicine doctors, there's also a long list of procedures that we do in the clinic, everything from dealing with basic skin concerns to other procedures to help with family planning. And then I would say, in terms of the procedures and surgeries that we do, the main difference between our style of family medicine and obstetric care as compared to an OBGYN is that we don't do other gynecologic surgeries. So any other surgery that involves the uterus or the ovaries, we refer out to our colleagues.
I do want to go back to the C-section question, and I have a follow-up. Can a woman just schedule to have a C-section just because she doesn't want to do it the traditional way, bring life that way?
So this is actually a really common question that people wonder, can I just get this surgery done? And you know, it's something you can talk about with your doctor. We really don't encourage an elective C-section for someone who doesn't have some other reason to need one, really mostly because it's a longer recovery, it can be more painful recovery. It is really, truly major abdominal surgery. People do tend to recover very well from them. So in cases where it's necessary, you know, it's definitely appropriate and doable, but I don't encourage you to seek it out if it's not something that you need. Now that said, the other thing that's important to know if you've had a C-section is, you know, you can have a vaginal birth in the future. It is potentially higher risk, so we will talk about that with you and decide if that's something you want to try. But after having 1 or 2 C-sections, it becomes high enough risk that some providers and some hospitals will not even let you try, just to the risk to you and to baby. C-section becomes the safer option after you've had 1 or 2 in the past.
What's the worst case scenario if a woman has had C-sections before and then she chooses to have a baby vaginally? I mean, what's the worst thing that can happen?
So the worst case scenario is extremely, extremely rare. Most of us only see it a handful of times in our career. It's called uterine rupture. The scar in the uterus is kind of the weakest point if you think of the uterus as like one big muscle. And with all those strong contractions, that's a lot of force to put on a part of the body. And in those extremely rare cases, if that starts to kind of tear open in that process of labor, that can be extremely dangerous to the life of the fetus and the life of the parent.
Okay, good to know. And it's really good information you just shared about some hospitals who choose not to do that for the safety of both mom and baby. So thank you for that. And speaking of baby, this has got to be probably one of the more fun things that you do, I would assume. The baby is born. You paint the picture for us. What happens immediately after the baby is born?
Yeah, so the first thing we do, our first priority after the baby is born, is to ensure that baby is doing well, that baby's breathing and responding appropriately to us. We typically dry the baby off, and if it's a vaginal delivery, we put, as long as baby's doing okay, we put baby up on the parent's chest and start skin to skin, ideally, while we're doing delayed cord clamping. So we oftentimes will wait 30 to 60 seconds to cut the cord, because we know that there are benefits to baby of doing that. Again, this is all assuming everything's going well with baby. So if in the uncommon and unfortunate situation where baby is having trouble breathing or things like that, the nursery team would take baby to do an evaluation and see if there are any other support or interventions needed. During a C-section, that always happens before we give baby to the parent. The nursery team always takes baby for an evaluation first.
I see. And what are the benefits to that skin-to-skin contact?
So skin to skin has many, many benefits to baby and to the parents as well. One thing is it reduces that stressful transition from being in this nice cozy womb to being out in the world. Being skin to skin with that nice warm, safe space is really soothing to baby. It actually helps establish breastfeeding sooner. You can start latching baby on and breastfeeding right away, and those pairs tend to have better breastfeeding outcomes long term if they can start right away. It can help reduce postpartum depression in the parents and just kind of help with bonding between the parents and the baby. It can help reduce the chance of low blood sugar in that baby. It reduces that stressful transition. So it really does help everybody.
Some excellent points there and benefits. I would like to share with the community that our hospital has once again received the prestigious baby-friendly recognition. So this has a lot to do with that. SVMH first obtained the baby-friendly designation in 2011. There are only 600 baby-friendly facilities in this country. So I would like to congratulate our doctors here and the entire team really for the role they have played securing this prestigious international recognition. And as a follow-up, since you are family medicine physicians, do you continue seeing mother and baby after the birth?
Yeah, we do. So after the delivery of a baby, we will continue to care for both the parent and baby while they're in the hospital, while you guys are bonding and working on feeding and recuperating from everything. We also will then see both you and baby for follow-up appointments, as well as, the other parent of baby, any aunts, uncles, cousins, grandparents, all of the above. So we will definitely see you and your entire family if needed.
Great. And in some cases, you'll be following that child or mom or dad all through older stages of life, right?
Exactly.
So is there anything else you'd like to add?
I always like to harp on just how wonderful it is to get to have that continuity of care throughout somebody's life. I think of it as, we're a team. It's just accompaniment through whether it's birth or illness or pregnancy or delivery or elder care, end-of-life care. It's really truly an honor to get to spend that time with someone for such a long time and with their family. That's really the beauty of family medicine, and that we get to do obstetrics as well is really, really such a joy. And I know we talked a lot about C-sections, and I want to just add, all of our goal is really just a healthy mom and healthy baby. We really do try to prioritize natural births, vaginal births, and the birth experience that each of you will be looking for may be different, and we want to work with you to achieve that. So we just looking forward to meeting you and hopefully taking care of your baby.
Took the words right out of my mouth. I have nothing to add.
Okay, well, thank you very much. I also want to point out that we have 5 other family medicine obstetricians at SVMC PrimeCare in Salinas. You are in fact looking at their photos right now. They are Dr. Russell Brunet, Dr. John Clark, Dr. Anastasia Click, Dr. James Liu, and Dr. Suzanne Rosen, and they also speak Spanish, so this is fantastic. We have this great team. If you would like to make an appointment with either Dr. Swanson or Dr. Capron or any of the other physicians that I just mentioned, please call SVMC PrimeCare. The number is right there on your screen. It's 831-751-7070, 831-751-7070. SVMC PrimeCare is located at 355 Abbott Street, Suite 100 in Salinas. Dr. Capron and Dr. Swanson, thank you for being here today, for providing so much information. I've learned a lot, and we really do appreciate what you do for the community and, of course, helping to take care of our families and bringing life into this world. So thank you so much for that. This video will stay right here on this Facebook page, so please like and share it. Also, please follow us on Twitter, Instagram, and LinkedIn. Thank you for watching. I'm Claudia Otero. We'll see you next time.